Welcome back. Joining us now is Jay Kempton, President and CEO of the Kempton Group, which is a third-party administrator of self-funded employee benefits plans. Jay, thank you so much for being here with us. Let's start right there. Can you give our viewers a description of what the Kempton Group is and what you do?
Sure. We, as you mentioned, we're a third-party administrator for self-funded benefit plans. Now we'll break that down into something that people can understand. Many employers around the country for years that choose to not buy health insurance in the traditional way will choose to self-insure their benefits at an employer level. Instead of writing a check and sending that off to an insurance company, instead they'll take those dollars, put it over into a bank account, and then they'll hire somebody like my company where we will then work with that employer and their employees to design a benefit plan that meets the needs of that employer. And then when the employees have medical claims, hospital claims, prescription claims, etc., those claims are submitted to the Kempton Group, and we process those claims and pay those claims out of this bank account that the employer holds. And the beauty of that is if there's dollars left over in that account, it doesn't go to my company or an insurance company. It stays right there in that account for the use of that employer for their employee benefits.
So you basically help a company, just to boil it down, to really act as their own insurance company.
Correct.
So the whole Obamacare debate has been cast in terms of coverage,
right,
and the problem being just who's covered and who's not. Is that, I mean, from what you've seen, you're down there at the ground level, is that the issue, the primary issue in healthcare?
You know, for the employers that we work with, coverage has never been the issue. It just really hasn't. I've been personally in this space for 24 years now, and it's always been the cost. Being that we work in this self-insurance field, the biggest cost item to one of our employers' health plan is the cost of the care, and that's really it. And that's really where they're focused. Those employers are focused on. They want to be able to provide the most bang for their benefit dollar back to their employees.
So you and the employers that you're working with, you've been able to estimate 9.7 million in savings. Is that correct? And so how does, help us connect the dots here with the kind of market and competition transparency? How does all that tie in with these savings?
Sure. You know, as most of the viewers know, that when we buy healthcare goods and services as just patients out there, a lot of times we don't even think of that purchasing decision as a purchasing decision. We simply get sick, we go to the doctor, but we really rely on the fact that we have health insurance, hopefully, to help pay those bills. However, there's very little knowledge about how much those healthcare goods and services actually cost before we purchase those. And so in any market where you've got sellers that don't have to advertise their prices, and you've got buyers that are having some third party pay for the product that they're purchasing, you can imagine that costs would tend to get out of control. We really started down this adventure. It really started with, I'm sure, one of your previous guests, Dr. Keith Smith from Surgery Center of Oklahoma.
Sure.
That Dr. Smith had posted their prices online for their facility. And really what we did was figured out a way where we could have the employees of our employers, if they got their services done completely voluntarily, but if they got their services done at Surgery Center of Oklahoma, the employer's health plan would just simply pay the posted price that is on the website.
One of the things that I think has been shocking to me is that price transparency. I mean, it's sort of a buzzword in healthcare. But price transparency just means what you would expect at the grocery store, right? To actually know what you pay.
Absolutely.
Does this, I mean, is this a revolution in healthcare, or is this, is this something that is important that people should care about?
Yeah, I think absolutely. Again, for my customers where either the employee and or the employer are directly responsible for the bill, they may be able to pool it amongst the other employees within that employer, but they are directly responsible for the bill. And so if you can tie together the cost of the coverage, tie that back to the cost of the care, Absolutely. Employees and their family members, they will start to care about price just like they do at a grocery store, or at a hardware store, or anywhere else.
I think this is a pretty big issue at the legislature this year. There's a measure, I think it's Representative Mulready and Senator Treat are moving through, that basically takes this kind of model. I think Oklahoma County has seen success, and a couple other municipalities, and the state is actually looking at doing that for all state employees.
Right.
Help our viewers understand exactly what does this mean? Why would the state be interested in this?
Yeah, there are, we know of about 25 medical facilities around this region of the country. Several of them right here in Oklahoma, again, started at Keith Smith's facility. But more and more medical providers are starting to offer this bundled cash pricing. And it actually turns out in a lot of these facilities, it's their best pricing that they offer. It's their lowest cost. And if you think about it, if they're offering a bundled price and it's for cash, they're not having to wait to get payment from an insurance company. They're not getting 80% of it paid and then having to wait for the other 20% from an employee that maybe has a hard time meeting their deductible. This is as close to cash on the barrelhead as possible. We usually pay these cash providers usually within 10 business days of the patient leaving the facility. So it's very near to cash. And once they're paid at 100%. The transaction is over. And so a provider can offer their best pricing in this. And once employees start to understand what, for instance, a shoulder MRI should cost, this is really the beauty of this, is caused it to kind of spread, is when an employee can go to a facility and they're made aware that the price for their shoulder MRI is $600, and their employer, because that price is so good, their employer is going to pay for it at 100%. The next time that employee or a coworker needs to have a shoulder MRI, they start to ask each other, well, what did you pay for that shoulder MRI? And if it's not $600, if it's $3,000, there starts a discussion about price.
Well, I know that Keith Smith and your organization have created the Free Market Medical Association to actually try to make this into a movement and spread these ideas around. Is that just here in Oklahoma? Is that nationwide?
I'll tell you what, hold that thought, and let's take a quick break and answer that, because I have a question about this too that I want to give you time to answer. Folks, we're going to take a quick break, and we'll be right back after these messages.